It's an emotional roller coaster for sure in 8th grade.
As time goes on, we realize that it's something that all of us are going to experience, and you can't really, it's something that you have to experience with others. Like it's hard to do it alone, so you need to reach out to other people. And I think as we evolve, we're realizing that, and so we're reaching out to more people, and through reaching out to people, it's spreading and it's becoming this bigger topic that everybody's more aware of.
It's very chaotic. There's so many things that are so unexpected that like things could like turn like any moment. Like one day, like one minute you can have like an amazing time, and then the next it's like all going downhill.
I've honestly just been stumbling through most of it. I've just been managing to keep myself afloat.
It's not as perfect as we make it seem. Childhood seems fun, but there are things that people are going through, and there are even times where like we just put on a show. Like most of us kids are really good actors, and you might not believe it, but some adults also don't know that we could be perfectly fine in front of you and laughing and happy, and as soon as we get around the right people, or as soon as we get into our own confined space, we cry, and we just hate ourselves. There are certain people who can't even look in the mirror because of how bad they hate themselves, but telling your kid, like, you can talk to me, and then whenever they try to talk to you, like, just bring them down, that's just gonna make it 10 times worse.
Life is evolving, and everything's getting harder, and so we have this extra pressure, but we also have this pressure to like continue to strive to be better and better, and sometimes that can get you down.
Being made fun of, like peer pressure, like for sure, like peer pressure is very, very stressful because you're like pressured to do something that you don't want to do or something that you're not ready for.
In-person social stuff is extremely difficult because it's just a matter of not getting upset at people for little things, because I have a bad habit of bottling up emotions. So then things just kind of pile up, and then someone says something that just kind of tips it all over.
Like last year, please take it easy on us. It's been a rough year, it's been a rough time. We're having a rough time. And we need your support.
Wow, what a way to start it out. That's why we're here today. So I hear things like chaotic, roller coaster, can't look in the mirror, take it easy on us. Don't you wish we adults would be that honest with each other? As I'm listening to that, I watch Dr. Lowery. You can't stop shaking your head. I hear it every day. Tell me about the work you're doing at Helen DeVos Children's Hospital, and if what these students are telling us is what is reflected across the board.
It is 110% what we're seeing. We are actually seeing, one of my friends at Wedgwood said this is a mental health tsunami. I've been doing this about 17 years now, over 17 years now, and the number of mental health crises, increase in eating disorders, increase in suicidal ideation, I've never seen anything like it before. And it is so complicated and complex, whether it's, I don't want to go back to school, I'm trying to balance COVID, I'm trying to balance all the societal pressures. So actually, I actually think they painted a prettier picture than what they're actually living. And I applaud their honesty.
All right, so Kaylee, are kids painting a picture that we as adults may not be seeing, or are they making it a little more flowery? Some of them said, they're great actors.
I think that masks have made it easy on us to become actors. We are hiding one of our biggest methods of communication with our mouths. So people are paying more attention to our nonverbals, our eyebrows, the way we're raising, the way we're curling up. And I think that as we become more aware that people are aware, we're changing that too. We don't want people to know when we're feeling that way. Someone said it best, that the pressure is on. We want to be perfect. We want to do well. And even on top of just school stresses, the stress of COVID. COVID-19 has added a brand new layer to stress of mental health, not just the precaution that comes with COVID, but the stigma of having COVID itself. We have had stigmas around sexually transmitted diseases and mental health disorders before, but have we ever had a stigma around a respiratory disease? Have you ever had someone say, wow, how did you get the flu? But now with COVID, people are judging you. They're assuming you didn't follow that universal precaution. They're assuming that you're not safe and that you're not a person they want to be around. And that causes an additional stigma. Not only are they missing school for 14 days to quarantine, now they're coming back to school and they're being judged because they were out of school for something that they couldn't even control.
Wow, go easy on us, huh? All right, so Kevin, you're working in one of our largest districts, East Kentwood, and let's talk about how we can create some safe spaces, because you're doing a great job in Kentwood. How are you giving kids the ability to come into school and know it's okay?
Yeah, so the first thing that we value is a relationship, is that we are in the relationships business, and we want children to know that when they walk into our schools, there are caring adults that are there for them. And that's the first and foremost thing that we do. So we start with that. We know that children can't be successfully academically until they're whole socially and emotionally. So we have to, as I think a culture, just really think about what our values are and what our priorities are. And hopefully our actions align with that. And we also have to have an honest conversation that children weren't well pre-COVID. You know, we were trending in a direction that wasn't sustainable before, and then it was exacerbated by the pandemic. And there's lots of factors for that. And you know, more isn't always better, and so whether it's more AP or more travel sports or, you know, the pressure for college acceptance, and at the same time our adults in our lives are busier or more stressed or strained, putting more onus on kids to navigate on their own. And so it's more of a, hopefully this is an opportunity to reset or level set what our expectations are of children, and hopefully more in line with what our values are as a community.
And then Chris, how does this play out in the work you do every single day when it comes to mental health?
Not good. I mean, that's the biggest thing in terms of what we've seen in the criminal justice system and the juvenile area. It's extremely concerning. Over COVID, we've seen probably an uptick in the crimes and the more serious crimes. Really the boldness, if you will, of some of what's going on. We had a number of, if you remember back in June of last year when COVID was really tons of car thefts from the dealerships, and they were driving through dealership windows. I mean, it wasn't just stealing the car, you broke into a car, they were going through windows, and then they'd use the cars to go do cell phone store break-ins. And when we started looking at it, they're pretty much, the juveniles from 13 years old getting involved in stuff like this, all the way up to 18, 19. And we were talking a little bit earlier, it's that high risk, the high-risk kids and the high-risk families, because this is not, we're focusing on the juveniles here and what impact that has, but it's also the family members, the adults who are in that family are probably also suffering from some of these issues, that it's a familial thing. And how do you treat that family? It's what these kids are, the behavior they're exhibiting there is not just the kids. It's a family issue that they're all dealing with stuff like this. And how do you get them the support and help they need?
And then Kaylee, the work you're doing at Wedgwood. I'm sorry, I'm going to go back. Carrie, let's talk about masking our emotions. Are we doing that?
Yeah, I think kids are really good at masking their emotions, and I think that substance use helps them to mask emotions because it helps them to put on a social front. They look cool when they're vaping, when they're using marijuana. So not only do they get the cool factor of I'm using these substances, but they're also getting an emotional relief from the trauma that they're experiencing, from the pressure that they're experiencing. And so I think it's a huge, larger spectrum than what we even realize, that kids are getting pressures from all areas, and substance use really helps them to feel relief from all of that.
If I had a dime for every picture on Facebook of the kids like that involved, and they're taking pictures with the marijuana, with the vapes, it's an image thing. They think it's kind of cool now.